how do we help someone with heart problems? Again, very serious medical condition here. Talk to your doctor. And heart disease, of course, is the #1 killer. And lots of reasons why people could have a heart problem. So let's get into this and talk about it. You'll want to talk to your doctor about improving circulation in the short term and improving hormone profile. But, what can we do long term? We know that drugs are not going to be an answer long term as far as getting rid of the problem. And surgeries definitely save people's lives, but most people don't want to go through bypass surgery. So what can we do here? For the health of the heart, not for treating heart disease, for the health of the heart, I'd recommend X39, X49, and carnosine. Now, one thing you could talk to your doctor about in terms of a patch protocol is using carnosine to relax the heart. You can try applying 2 or 3 patches around the heart. One simple protocol you can do with your doctor is to take your index finger and simply press around the heart. And when you find a point of pain, apply a patch there. And you might end up with 2 or 3 patches. And then keep track of your blood pressure and or if you're on an EKG and see how you do. You may find that helps your heart relax. So what do we want to do here if someone has, let's say, hypertension, elevated blood pressure, heart disease, and this is associated with arterial blockage? Cardiologists are not trained to be looking at some of these natural solutions. One that goes back to the 1930s is buckwheat seed extract. There's only one company I know of that makes it. It's standard process, and the name of the product is called Cyruta. And it's been shown that this will remove arterial plaque and restore blood flow. So when we talk about elevating nitric oxide or taking a natural blood thinner, taking aspirin, those are going to be things to do temporarily. What we really want to do is get the health of the arteries back, and you can do that with Cyruta. Another product that's been through clinical studies is pomegranate extract. A company called Life Extension sells that. Name of the product is called endothelial defense. Pomegranate extract, clinically proven to remove arterial plaque. So you'd want to do that over a period of 6 to 9 months using those supplements. And of course, get an ultrasound, get diagnostics to see where the health of your arteries are at, so you know for sure. Vitamin D has been shown to improve the elasticity of the arteries. So you might have a vitamin D deficiency. So talk to your doctor about, 5,000 IUs per day of vitamin D. Niacin is very common, used for arterial health. You're going to need to talk to your doctor about that because you can get into very, very high doses of niacin, which produce a niacin flush. Talk to your doctor. Potassium. One way to naturally lower blood pressure is potassium, 1,000 milligrams per day. You could have too much sodium in your body and not enough potassium in your diet. So eating things like bananas and seeds and avocados might not be enough. You might need to take 1,000 milligrams of potassium citrate per day. Critically important if you have high blood pressure. Beta-alanine, of course, helps elevate carnosine, which supports the health of your heart. NAC will get elevate glutathione, which helps manage the inflammatory process. And again, nitric oxide, different methods of improving blood flow. Magnesium threonate These three specifically, if you've got high blood pressure, please talk to your doctor about this combination. Let's say 200 to 400 milligrams daily of magnesium threonate, 100 to 800 milligrams daily, 900 milligrams of algae cal, and 3 to 5 grams per day of taurine. These will calm the nervous system, help with muscle contractions in the heart, and naturally reduce blood pressure. Did you know that clinical studies show that taurine is a natural antihypertensive, natural blood pressure medication, the amino acid taurine? So if you're suffering with high blood pressure, please, and you're on medication or not, please talk to your doctor about this combination. How do you help someone with a viral infection? Well, unless you're a healthcare practitioner,